What if the first sign of a stroke didn't look like a stroke at all? Not facial drooping, not paralysis, just a strange moment of confusion, a sudden difficulty swallowing, or a brief flicker in your vision. You brush it off. But what you may have just experienced is something far more dangerous, a mini stroke. Medically known as a transient ischemic attack, or TIA, a mini stroke occurs when blood flow to a part of your brain is briefly interrupted. And while the symptoms may vanish within minutes, the warning is real. According to the American Stroke Association, 1 in 3 people who suffer a mini stroke will go on to have a full-blown stroke, often within just 90 days. Even more alarming? Nearly 87% of all strokes are ischemic, meaning they involve blocked blood flow just like in a TIA. These are not rare events. In fact, someone in the US has a stroke every 40 seconds, and thousands more experience mini strokes every single day, often without ever knowing it. Recent studies published in the Lancet Neurology and Frontiers in Neurology have confirmed that TIAs are not harmless. They cause measurable brain dysfunction, increase inflammation, and signal underlying vascular problems that could explode into a catastrophic stroke if ignored. So in today's video, we're going to uncover the 11 subtle yet scientifically verified symptoms of mini strokes that could easily be missed, but shouldn't. From sudden confusion to garbled speech, from unexpected mood swings to unexplained exhaustion, each sign is your brain's cry for help. And one symptom, number 9, might completely catch you off guard. If you're over 50, if you have high blood pressure, diabetes, or a history of cardiovascular disease, this is a video you simply can't afford to skip. Because when it comes to strokes, time isn't just money, it's brain. Let's get started. Symptom 1, sudden numbness or weakness. Let's start with one of the most common and recognizable symptoms. When blood flow to the brain is interrupted, even temporarily, it can cause sudden numbness or weakness, especially on one side of the body. This typically affects the face, arm, or leg, and it's one of the classic signs healthcare professionals look for. According to the NIH Stroke Scale, which is the gold standard assessment tool used in emergency rooms worldwide, this unilateral weakness is a key indicator of stroke activity. What happens is that when blood flow to certain parts of the brain is interrupted, even temporarily, it affects the brain's ability to send signals to muscles on one side of the body. You might notice this as a heavy feeling in your arm, difficulty lifting your leg, or a strange sensation like your limb has fallen asleep. But unlike normal pins and needles, this comes on suddenly without any obvious cause, like sitting in an awkward position. The key word here is sudden. This isn't something that develops over hours or days, but rather minutes or even seconds. If you experience this, try the arm raise test. Hold both arms out in front of you for 10 seconds. If one arm drifts downward or you can't raise it as high as the other, seek immediate medical attention. Symptom 2, partial or total loss of consciousness. While it's not the most common symptom, partial or total loss of consciousness can occur with mini strokes. According to Johns Hopkins Medicine, this is one of the more serious symptoms and always requires immediate emergency medical attention. Partial loss of consciousness might manifest as feeling extremely drowsy or unable to stay awake, even in situations where you'd normally be alert. You might feel like you're drifting in and out of awareness, or others might notice that you're not responding normally to questions or stimuli. Total loss of consciousness, actually passing out, is less common with mini strokes than with major strokes, but it can happen, particularly if the mini stroke affects the brain stem or if multiple areas of the brain are involved. This might be preceded by feeling lightheaded, seeing spots or darkness creeping in from the edges of your vision, or feeling like you're about to faint. If someone loses consciousness even briefly and shows any other signs of mini-stroke or stroke, don't wait to see if they wake up on their own. Call emergency services immediately. Time is absolutely critical in these situations. Symptom 3. Temporary memory loss. Picture this: you're in the middle of a conversation, and suddenly, you can't remember what was just said, or even who you're speaking to. You're standing in your living room, yet for a moment, it feels unfamiliar. These are not just fleeting lapses of memory due to aging. They could be the brain's warning flare of something far more serious, a mini-stroke. According to a 2017 study in the journal Stroke, temporary memory loss, especially when tied to disorientation or confusion, is a key but often overlooked symptom of transient ischemic attacks. This kind of memory disruption is abrupt, intense, and deeply unsettling. People may suddenly lose track of where they are or forget people they've known for years. They might perform routine tasks and forget midway through, or feel like time has vanished without explanation. What makes this particularly dangerous is that the person experiencing it might not even recognize anything is wrong. That's why awareness from family and friends becomes essential.
Can you tell me?
If you ever notice someone drifting in and out of awareness or asking repeated questions in a short time span, don't brush it off. It could be their only window to seek help before a full-blown stroke strikes. Symptom 4. Tingling sensation. Have you ever experienced that pins and needles feeling when your foot falls asleep? Well, mini-strokes can cause similar sensations, but with important differences. NIH clinical studies have shown this is a common early warning sign of mini-stroke that people often dismiss as a limb falling asleep. However, there's a crucial difference between normal pins and needles from sitting in one position too long and mini-strokes, related tingling. The mini-stroke, related sensation comes on suddenly, without any apparent cause, often affects one entire side of the body, and may be accompanied by weakness or numbness. The tingling might start in your fingers or toes and spread up your arm or leg. Some people describe it as feeling like tiny electric shocks or like ants crawling under their skin. Unlike normal pins and needles that get better when you move around, mini-stroke related tingling doesn't improve with movement, and might actually be accompanied by clumsiness or difficulty using the affected limb. This symptom occurs because the sensory pathways in the brain that process touch and sensation are being affected by the temporary lack of blood flow. Even if the tingling seems mild or goes away quickly, it's still a warning sign that shouldn't be ignored, especially if it's one-sided or accompanied by other symptoms. Symptom 5. Difficulty swallowing. It's a symptom few people expect, but when it hits, it can be terrifying. Imagine taking a sip of water and suddenly feeling it lodge in your throat, or coughing violently as you try to swallow something as simple as your own saliva. This isn't just a random choking incident, it could be your brain sending an urgent signal that something is wrong. Difficulty swallowing, also known as dysphagia, can strike suddenly during a mini-stroke. A 2020 study in Frontiers in Neurology highlights how critical this symptom is, as it indicates that the brain's finely tuned swallowing centers, relying on multiple cranial nerves and coordinated muscle control, are momentarily disrupted due to reduced blood flow. This sudden interference can throw off the entire process, making even the most basic actions feel impossible. You may feel like your throat is closing, as if there's an invisible lump that won't go away. Food or drinks might seem to go down the wrong way, triggering coughing fits or a choking sensation. Some people even notice an increase in drooling because they're unable to manage saliva as usual. What makes this symptom especially dangerous is the risk of aspiration, when fluids or solids slip into the lungs instead of the stomach. This can lead to serious infections like pneumonia, particularly in older adults. If you ever find yourself struggling to swallow without any known cause, and especially if it happens alongside other strange symptoms like dizziness, numbness, or slurred speech, don't ignore it. Avoid eating or drinking anything further, and seek emergency care immediately. This isn't just a swallowing issue, it might be your body's first cry for help. Symptom 6. Sudden severe headache. We all get headaches from time to time, but the headache associated with a mini stroke is different. According to the Cleveland Clinic, this is especially concerning when it occurs with no clear cause and feels different from any headache you've experienced before. This isn't your typical tension headache or even a migraine. It's often described as the worst headache of your life. The pain might feel like a thunderclap, coming on within seconds and reaching maximum intensity almost immediately. Some people describe it as feeling like their head might explode or like someone hit them in the head with a baseball bat. The pain might be localized to one area or spread across your entire head. What makes this headache particularly significant in the context of mini stroke is that it often comes with other symptoms like confusion, vision changes, or difficulty speaking. The headache itself is caused by changes in blood flow and pressure in the brain's blood vessels. It's important to note that not everyone with a mini stroke will experience a headache, and not every severe headache is a sign of mini stroke. However, if you experience a sudden severe headache that's unlike anything you felt before, especially if accompanied by other symptoms on this list, don't wait, seek emergency medical care immediately. Symptom 7. Facial drooping. One of the most visible signs of a mini stroke is facial drooping. This is perhaps the most recognizable symptom and a key component of the fast stroke test: face, arms, speech, time. When one side of the face suddenly becomes weak or numb, it can cause that side to droop noticeably. This happens because the facial nerve, which controls the muscles of facial expression, is affected by the reduced blood flow to the brain. You might notice that one side of your mouth droops down, making it difficult to smile evenly. Your eye on the affected side might not close properly, or your eyebrow might sit lower than the other. The classic test for this is to try to smile in front of a mirror. If your smile is lopsided or one side of your face doesn't move properly, this is a clear sign of a potential mini stroke or stroke. You might also notice drooling from one side of your mouth or difficulty keeping food or liquids in your mouth on the affected side. This symptom is often accompanied by numbness or a strange sensation on one side of the face, similar to the feeling you get after dental anesthesia. However, unlike dental numbness, which develops gradually, this comes on suddenly and without any obvious cause. Symptom 8. Loss of balance or coordination. Here's a symptom that people often mistake for something else: sudden loss of balance or coordination. Research published in JAMA Neurology in 2019 highlighted how common this symptom is in mini stroke patients, yet it's often attributed to other causes like inner ear problems or simple clumsiness. This isn't just feeling a bit unsteady. It's a sudden, dramatic change in your ability to coordinate movements. You might feel like you're on a boat in rough seas, unable to walk in a straight line, or you might find yourself veering to one side when you try to walk. Some people describe it as feeling like they're drunk when they haven't had any alcohol. The loss of coordination can affect fine motor skills too. You might suddenly be unable to button your shirt, write legibly, or pick up small objects. These tasks that you do automatically every day suddenly become difficult or impossible. This symptom is particularly dangerous because it increases the risk of falls and injuries. If you experience sudden balance problems, sit down immediately in a safe place and call for emergency help. Don't try to walk it off or wait to see if it gets better. This is your brain telling you something is seriously wrong. Symptom 9. Vision problems. Have you ever felt like a shadow suddenly passed over your vision, like a curtain being drawn across one eye? Or perhaps you opened your eyes and the world appeared doubled, distorted, or covered in a strange gray fog. These aren't ordinary signs of fatigue, aging, or needing new glasses. They may be one of the earliest and most overlooked warnings that your brain is in trouble. Mini strokes, or transient ischemic attacks, don't always announce themselves with pain or collapse. Sometimes, they whisper, through your eyes. When blood flow to the retina or visual processing areas in the brain is briefly interrupted, the result can be sudden and temporary visual changes that feel strange but vanish quickly. But don't let their fleeting nature fool you. Whether it's blurred vision, seeing two of everything, or temporary blindness in one or both eyes, these symptoms are your brain's emergency signal. Unlike gradual vision decline that occurs with age or eye strain, these disturbances hit out of nowhere, sometimes lasting just minutes. But every second matters. Even if your sight returns to normal, you're not in the clear. This sudden visual glitch could be the body's urgent cry for help, a cry that, if ignored, may be followed by a full-blown stroke. Recognizing this sign and acting fast could not only save your eyesight but your life. Symptom 10. Sudden confusion. Moving on to a symptom that's often overlooked, sudden confusion. According to research published in the journal Stroke in 2018, this is one of the most underrecognized symptoms of mini stroke. This isn't just feeling a bit foggy. It's a profound disorientation that comes on abruptly. You might find yourself unable to understand simple sentences or conversations that would normally be easy for you. Some people describe it as feeling like everyone around them is suddenly speaking a foreign language. Others report being unable to follow basic instructions or complete simple tasks they do every day. This confusion can manifest in various ways. You might forget where you are, what day it is, or even who people around you are. You might start a sentence and completely forget what you were saying midway through, or you might find yourself unable to solve simple problems like how to use your phone or open a door. What makes this particularly dangerous is that the confusion itself can prevent you from recognizing that something is wrong. This is why it's so important for family members and friends to be aware of the symptom. They might need to be the ones to call for help. Symptom 11. Slurred or garbled speech. Have you ever noticed someone suddenly struggling to speak clearly? Speech difficulties are another critical warning sign of mini stroke. The American Stroke Association specifically identifies slurred or garbled speech as a key indicator. This happens because the areas of the brain responsible for speech and language processing can be affected by reduced blood flow. You might find yourself unable to pronounce words correctly, speaking in a way that sounds like you're drunk when you haven't had any alcohol, or your words might come out jumbled or in the wrong order. Sometimes people report knowing exactly what they want to say but being unable to get the words out properly. Family members or friends might be the first to notice the symptom. They might say you're not making sense or that your speech sounds strange. This is different from simply forgetting a word. It's a physical inability to form words correctly. A simple test is to try saying, "The early bird catches the worm," or any tongue twister. If you suddenly can't say it clearly when you normally could, this is a red flag that requires immediate medical evaluation. Mini strokes may seem small, but their consequences are anything but. These brief episodes are your brain's red alert, whispers of a major storm on the horizon. Recognizing the signs early could mean the difference between recovery and disability, between life and death. So don't ignore the signals. If you or someone you love experiences any of these symptoms, no matter how quickly they disappear, seek medical attention immediately. The clock starts ticking the moment blood flow to the brain is compromised, and every second matters. If this video helped you feel more informed, more prepared, or even just a little more aware, then please do one simple thing. Hit that subscribe button and tap the notification bell so you never miss our future health breakdowns. We're here to turn complicated science into life-saving knowledge, and we'd love to have you with us on that journey. Share this video with someone you care about, it might just save their life. Until next time, stay healthy, stay alert, and stay connected.